Very quickly, I'd like to go over shock. Shock is a way of saying the blood in the body is not getting to the organs that need it. Simple. That's all it is. The blood in the body is not getting to the organs that need it. And even easier, we have the types of shock named by essentially what causes them. So, first off, we'll start with cardiogenic shock, and there's slides for each of these. But here's a normal vessel, so normal heart activity, normal cardiac output, and then normal flow. Vessel size, good, normal flow. Cardiogenic shock is when there is something heart related. Something has affected the heart's ability to beat. The heart is not giving as much blood, so afterload is affected. There's reduced flow, and that's called cardiogenic. It's created by the heart. Less blood from the heart, lowered blood pressure. This is the only type of shock where the heart is not working. Vascular shock refers to a condition where the heart is working normally, normal cardiac output, but the flow is reduced only because the vessels have dilated, and they've dilated very quickly, and we've lost this input from the vessel wall. There's sensory receptors there that tell us that there's adequate blood flow. When that is lost too abruptly, that leads to shock. So an abrupt drop in blood pressure. Then we have hypovolemic, which just means low blood volume shock. So cardiac output, is normal, but what is not normal is the fact that there's fluid being lost. If there's fluid lost, then flow is going to be reduced as well. So this is going to involve mainly rapid blood loss. There are other causes of it, but something fluid related is lowering the blood pressure because there's volume loss. Okay, then there's one topic we didn't talk about. It's neurogenic, which means generated or created by the brain. So this could be due to a couple of different cases. This is one of my favorite movies, the Rocky Horror Picture Show, and this is Susan Sarandon, and she's just gotten to the castle of Dr. Frankenfurter. And they're singing this song, Just a Sweet Transvestite. And she is so shocked by this song. She's in such emotional distress that she says, "Oh, my stars, Brad!" And she passes out from emotional distress. So emotional distress can cause this. Also severe pain or injury. So really intense pain can cause you to pass out. You've lost blood flow to the brain. And the part of your brain that you think with is the lining of your brain. The outermost layer is the cerebral cortex. And when that loses blood flow, that signals to the medulla that it's not going to work anymore. It's going to shut off for the meantime. This is also the way that general anesthesia works. It doesn't involve the cerebral cortex. It involves drugs being given to affect the cardiovascular center. Spinal anesthesia, so something like an epidural, would do this at the level of the cord so that you can actually be awake during things like delivery of a child, but not feel anything. But in these cases, there's some sort of stressor, pain, or a drug that's given, and there's reduced sympathetic output to vessels. So vessels become dilated, and then there's reduced sympathetic output to heart, so that the heart reduces its rate, reduces its stroke volume. So you have dilation plus reduced volume plus low heart rate. That's going to lead to a very abrupt drop in blood pressure, which is what we call shock. And because there's no perfusion of the cerebral cortex, you pass out. This is also called primary shock. So this is going to reduce cerebral blood flow. The most common cause, as I just mentioned, so emotional trauma, pain, vivid experiences, something like an anesthetic can also alter this nervous system output. So there's vasodilation, this fall in output, you feel lightheaded, and the science word for fainting is syncope. Syncope. The cool thing about syncope is that this is, you have to, like in the case where it's a vivid experience and you're really upset, you've got to have your cerebral cortex knowing that you're upset and sending that message forward, and then there's no blood flow, and then that's signaling to these lower brain areas to cause this drop in blood pressure. So when fainting occurs, that actually blocks this feed-forward mechanism saying this is the OMG, like, crazy. And then it goes to the lower brain centers to lower blood pressure. So when syncope occurs, it blocks this, which means that usually vasoconstriction is restored just because you pass out and you limit that feed mechanism. That stress leads to this. So really immediate onset of symptoms, so you pass out really quickly, and then people come awake very quickly too. With drugs, it obviously is a little bit more serious, so you have to give things to wake them up, like vasoconstrictors or other medications. If somebody fails to wake up from something like this, they do have something in first aid kits. They're called smelling salts. I recommend you not try them for fun. They're not as much fun as you think they would be. They like singe the nose hairs inside of your nose, but they smell so terrible that they wake you up immediately. So that's something you could try. If they still don't wake up from smelling salts, then you call 911. But you should still call 911 just in case they hit their head or they're disoriented and might need aftercare. Okay, cardiogenic shock. Again, that means something heart-related has failed. Maybe they had a heart attack. Maybe something is blocking the ability of the heart to pump, or they have an abnormal heart rhythm. The way that this is diagnosed is to catheterize through the heart, which lets you know that that's pretty serious. The most common cause of cardiogenic shock is left ventricular failure in a myocardial infarction. When more than 40% of the myocardium is lost, that will lead to cardiogenic shock. 80% of those cases of cardiogenic shock lead to death. So it's a very serious thing. Other causes could be a thrombus that's formed and obstructed the blood flow, cardiac tamponade, which is when the pericardium fills with fluid and it's restricted from beating. Tension pneumothorax is when the lungs are not fully filled and then they collapse and they compress the vena cava, which immediately limits blood flow throughout the body. That one can be restored, so can tamponade. You can aspirate that. Thrombus, you can try to dissolve that with streptokinase, but in MI, there's only so much you can do to try to restore the heart to working again. Hypovolemic, it means that there's not enough blood volume. Most common cause is severe bleeding following massive trauma. So an area that bleeds a lot, like when the aorta ruptures, for example, that's an internal bleed. So by the time the blood's actually coming out, it's already filled up wherever the cut was. So the abdominal cavity, the thoracic cavity. Rapid loss is more severe. You can also see this in venous obstruction when you don't get drainage. You can see this in dehydration because the plasma is water. It's 95% water, so really substantial water losses. In like heat stroke, you can see that leading to hypovolemic shock. And also third-degree burns. We think about skin being there to keep stuff out of us, but it's also there to keep stuff in, like our body water. When people are in burn units, they have dressings on them. Those dressings are wet, and those help prevent losses to evaporation in the case of burns. So these are all cases where we're losing body volume, either blood, plasma, water, hypovolemic shock. Vascular shock is a class of shocks. They just reveal that something has made the blood vessels dilate very quickly, and now there's not a good relationship between the amount of blood and the size of the vessels. So a type of vascular shock is septic shock. So this has to do with bacterial cell walls, causing the release of different cell mediators, major vasodilation. There's also a lot of blood clotting with this. So septic shock is very dangerous, and it's a type of vascular shock. Toxic shock is when there is the release of cellular mediators like histamine and things of that nature, but it's not because of bacteria, it's because of something that's non-bacterial but foreign in origin. So toxic shock syndrome, you mainly think of tampons with that, but the original tampons were designed to be kept in the body for days at a time, and it turned out people started going into shock because the body thought that that was a foreign body and it should keep attacking it. Anaphylactic shock is a type of vascular shock. There's a huge amount of histamine release, serotonin release, because of an allergic reaction. So again, that can lead to syncope or passing out because there's so much vasodilation. And then there's one final one, which is pharmacologic, and that's the mix of too many Vasodilating drugs, you see that with nitroglycerin taken with an erectile dysfunction drug like Viagra. So Viagra is a nitric oxide donor. So if somebody takes their Viagra and they start engaging in intercourse, then they have chest pain, they'll pop a nitro, but now you have nitro plus nitro, which leads to really severe vascular shock. So those are a class of vessel shocks. So what do you do? Well, it depends on what type. If it's hypovolemic, you got to give back some volume, fluids, blood, whatever is needed. Neurogenic or vascular, again, vasoconstrictors can be used. If it's that primary one, smelling salts work. Cardiogenic. This, again, it's usually after a really intense myocardial infarction. There's a drug called isoproterenol. It's got a 3-week half-life. It's a crazy drug. And what it does is increase the heart rate and its force of contraction, but maintains the dilation of vessels in the system so that the heart's not working really hard against a high afterload pressure. If it is cardiac tamponade, yeah, aspirate that compression. Then there's the shock position. You put somebody on their side. Vasodilation is a way that you lose heat, so people get cold. So there's shock blankets that you would get after like a marathon to try to prevent you from going into shock by keeping you warm, because too much vasodilation can lead to shock. So all like blankets, they should be put on one person. If you suspect that their neck isn't injured, you turn the head to the side so that they don't vomit and then aspirate it, because that will lead to death as well. And then systemic effects are just the result of organs not getting the oxygen that they need. So those are anoxic effects. If the lungs are affected, that leads to ARDS, adult respiratory distress syndrome. When the kidneys are affected, they stop making urine. They encourage your body to hold on to substances that should be excreted through the urine, and then you could go into acidosis, and then low pH doesn't support life effects. The GI is the most terrible one, because when the GI loses blood flow, the mucosa dies, and then it perforates, and now you have the contents of the bowel in the body, which causes septic shock. So there's already shock, and then you have another type of shock. So shock just keeps getting worse unless you catch it at the right time. And the rule with shock is that you don't know when it's going to kill somebody or not. So the rule is, when there is a huge drop in blood pressure, you continue shock therapy either until normal blood pressure and system values are restored, or until death occurs. There's no way to know if the shock is reversible or not. So shock therapy is continued until everything goes back to normal and it's maintained, or until there's death. Otherwise, it just keeps progressing. And so non-progressive means everything worked and their blood pressure is normal and they can go home and they're happy. Progressive means that things are going to start dying due to anoxia one by one until the body stops working. And again, irreversible is when they're going to die, but you do not know when that is. So you continue doing shock therapy until either death occurs or everything is compensated for. And that is the end.